session with Charles Pappas. Charles Pappas is actually editor at Exhibitor Magazine, an award-winning editor. Actually, he probably can explain much better than me what all these awards mean, because as we all know, they are different awards, not everybody knows. But still, we will talk about how the new normal is going to look like, and if we are already ready for the new normal, or if there's some time to wait. But still, Charles, maybe you introduce yourself first, and then we can look and see what you have to tell us.
Well, thank you, and good morning and good afternoon to everyone here. I've been a writer and sometimes editor at Exhibitor Magazine for about 20 years now. So I do a lot of research articles. And of course, with COVID-19, we've had to segue into doing a lot of research on the pandemic itself and what it means to the industry. So today I want to talk a little bit about what the current status of things is, what we need to worry about, what we might not have to worry about, what the good news is, and unfortunately, what the bad news is too.
Great. Actually, you have wrote a book about Expos, which I should mention because, well, I'm a fan of one of your many fans, and I just read it, and it's really inspiring. Looking for our travel to the World Expo in Dubai happening this winter. Yeah. So.
Yes,
but,
my book, I wrote it about, it's interesting, I wrote it about the power of trade fairs and World Expos to change history. And really the World Expo is just an exaggerated form of the trade fair. And the trade fair, its template came from World Fairs starting in 1851. So unfortunately though, it's an industry, you know, both things, we pack people together. And that's not necessarily a good business model right now. So we have to try to get back to some kind of normal. And later this year, the World Expo in Dubai will be taking place finally, and we can get back to our normal again. I think that actually will turn out to be one of the major events in getting the exhibition industry back, when we can see that literally millions of people can go to an event and be okay.
Yeah. So this actually brings me to my first question. Are things right now getting better, or are there, do we have to expect that they are getting worse?
Well, it's a little of both. And let me start with the bad news. Right now, the world's focus is on India, and for good reason. They're hitting about 400,000 new infections a day, which is incredibly bad. But it may be worse than that. The Department of Health Metrics and Evaluation at the University of Washington here in the United States believes that the number of infections actually is about 5 million per day. Also, the state of Goa in India, they're testing there at a 50% positivity rate, meaning 1 out of every 2 people that gets tested has COVID. This is especially bad because all these people getting infected means there's more people who can give rise to variants, which our current inoculations may not be able to handle. And right now, India has about 2.4% of its population vaccinated, that's all. Now, how this affects us is in kind of an odd way. Many people don't know that India is one of the world's leaders in producing vaccines. Their Serum Institute currently ships out about 60 to 70 million doses of vaccine a month. But because of their situation, they're going to have to draw back. They can produce more, but more of it is going to have to go for their own country. And currently, they ship out to about 70 different countries. So, and those countries, therefore, will be receiving fewer vaccines, which in turn is going to affect us. Now, I can give you some good news though. The rest, even though 8% of the world is vaccinated to some degree, there are some pockets of success. In the United States, 34% are fully vaccinated, about 46% partially vaccinated. In Germany, 9% fully vaccinated, 32% partially vaccinated. In the UK, 25% fully vaccinated, 52% partially vaccinated. We are making progress in those areas. And here's another good piece of news, especially for the exhibition industry. We now know, according to St. Jude's Research Hospital in Tennessee, that just one shot will give you roughly 79% protection in terms of passing on the virus. That is, you could be inoculated, but carry the virus and spread it to others. One shot will prevent about 79% of that from happening. The Israeli Health Ministry tested the Pfizer vaccine and the Pfizer BioNTech vaccine rather, and discovered that can prevent transmission from the inoculated to the uninoculated by 97%. And where I live in Minnesota is where Mayo Clinic is. And their research on the Moderna vaccine showed that it can prevent passing it on by 89%. So we have some very good news for people who are going to congregate with others, even if some of them are not vaccinated yet.
Well, this sounds like we can open up all show centers, all trade show venues, don't we?
Well, yes, I think we're going to see it no matter what, but here's the situation, at least in the United States. Now, as of May 1st, the state of Nevada, in which Las Vegas is, has opened up completely and let the local communities decide what they want to do for protection. So that means Las Vegas can make its own rules right now. And one big test of this will be the World of Concrete show that's going to take place in June. That usually has about 54,000 attendees. I don't think there'll be that many this time, but certainly there will be many. They're going to use this probably as a test case to determine, do we still have to stay 6 feet apart? Should we wear masks? Should we do temperature checks? All of those things. So I would watch that very carefully when it takes place and see what the outcome is. New York will be open as of May 19th, and New York, that is the state of New York. The city of New York should be completely open by July 1st. California should be completely open by June 15th. Now, currently, we've also seen some recent shows take place, like it's called Win the Storm. Storm-related businesses in New Orleans. 3,500 people showed up for that, and there did not seem to be any problems. The large software company Salesforce will be holding its Dreamforce trade show pretty soon. In Chicago in July, they're going to hold the auto show, which is typically huge, but they're going to cut it down from 9 days to about 4 days and allow no more than 10,000 people in at one time. So these are experiments, if you will, to see if we can get back together and what the outcome is. Do people get infected? Do people feel safe even? Now, here in the United States, the Freeman Company has done some interesting research, and so has Exhibitor Magazine, where about 85% of attendees and 86% of exhibitors generally feel that by the last quarter of 2021, we'll be back to attending shows. That seems to be true across the board, that we do expect by the last quarter of this year to be back to some kind of normal. So I would say we should be doing shows again pretty soon. And indeed, the World Expo will open up in October in Dubai. So we'll have a sense of whether people want to travel and can travel and feel safe.
Actually, Charles, since you're Native American, with Greek sources, but still you're Native American. And I know this trouble from Germany as well. Who does take decisions? Is it the city? Is it the county? Is it the state? Is it the government in general? Who's responsible for what?
Oh, in America, it's a mess. And what I mean is, it could be up to the states, it could be up to the federal government, it could be up to the cities. Let me give you an example. We don't have a federal registry of vaccinations. So the federal government does not know who has actually been vaccinated. The states and sometimes just the cities do. So in some cases, the federal government will have rules. For instance, the Transportation Security Administration mandates mask wearing on all public conveyances, meaning trains, airplanes, and things like that. Okay, but the states like Texas and Florida have banned certain people from saying you have to use masks. It will, in the United States, if you go to shows here and go to several shows, one state and one city will be different from the other. New York City will probably be different from Dallas, Texas, and those will be different from Orlando, Florida. It's going to be a mess for a long time because we tend to rebel against federal authority here. So you're going to see these local decisions made that are going to vary wildly. And for the exhibition industry, and if you go to a lot of shows, this is going to be chaotic. This is going to be very difficult to deal with for a while. Some places will demand masks. Other places won't care. Some shows will use temperature scanning. Others won't. And I suspect many shows are going to be a mix. That is, where many people insist on not wearing masks, shaking your hand, while other people will wear masks and only want to elbow bump. And there's going to be a clash of cultures, I think, for at least the rest of this year in the United States.
Okay. And well, we learned quite a bit about vaccination passports. Over in Europe, we are right now discussing how this can run, how we can make sure that only vaccinated get a vaccination passport. Right now we have, well, I have mine at home, a vaccination passport, a yellow document where all your vaccinations are written by hand and stamped by a doctor, which is easily to build by yourself. You just need some yellow paper and a copy machine. No, just kidding, a little bit difficult, is it? More difficult is it? But still, well, on the other hand side, we are facing right now, Bruno is showing his, yeah, this yellow document. On the other hand side, we are right now struggling with the idea, okay, how do the vaccinated people maybe get the automatically vaccination passport, because then they have to go back to their doctor. The doctor say, take this away. Yeah, I don't have the time for issuing it. So what is the current situation over in the US on this?
Well, this is kind of interesting. And Ute, you brought up a nostalgic memory. In the 1970s, when I began traveling overseas, I had to have the yellow card too, to prove I'd been inoculated against yellow fever and those other things. And you're right, my doctor filled it out by hand. There was no QR code or anything like that then. But here's the situation here. The federal government has decided not to decide that we will need vaccine passports, which by the way, the term vaccine passport is a little bit of a misnomer. It could mean something attached to your passport, or it could just mean a document that says you are vaccinated and can enter a gymnasium, or you can go to a health club, or you can go to a restaurant. Now, right here in the United States, the individual states will be able to decide if they want to use vaccine passports. Texas and Florida have banned them. However, New York State is using one designed by IBM called Excelsior, which basically works this way. You download your file from your doctor. It shows up as a QR code on your phone, and then an institution, a restaurant or a gym or even a trade show venue would be able to have a reader that looks at it and says you've been vaccinated. This is starting to gain currency around the world, though. China is interested. The EU may use it, even though each of the 27 members could have their different criteria. Israel is currently using the Green Pass, which again gives you a general access to places, just indicating that you've been inoculated. The airlines are even experimenting with this. In fact, Lufthansa, JetBlue, and Virgin are using, with some of their flights, using Common Pass, which again is very similar to an app with a QR code that says you've been vaccinated. The International Air Transport Association is also experimenting with this with 25 different airlines using a health pass. Emirates Airlines, Singapore, Korean Airlines, they're trying versions of it now. I suspect we're going to see some kind of usage of this, but again, it will be a patchwork. Places here won't use it, but a place here will use it. So I suspect people in the trade show industry are going to have these documents for those places that will demand it. And even then, here are some interesting points. What vaccinations will they accept? Now, the EU and the United States, for those who do use a kind of vaccine passport, they'll probably accept Pfizer, Moderna, Johnson & Johnson, and AstraZeneca. But would they accept Sinopharm from China or Sinovac from China? Would they accept the Sputnik vaccine from Russia? These are all logistical details that will have to be worked out so that people in the trade show industry can travel and know what requirements they're going to have to meet in these different locations. Otherwise, it's going to be a bit of chaos for a while.
You know, I strongly believe that airlines, trade show venues, and organizers will push into one direction using vaccination passports, however they're going to look like, because, well, you know, if you want to travel and you need to have this passport, you can decide in either having it or not having it, meaning travel or no travel. Then people who want to travel, just going for holidays, will use it. Yeah. And do you see any movements in this direction over in the US?
I believe there will be a movement towards it for several reasons. Mainly, it would take the responsibility off of venues if we knew that international travelers, at least, had already presented such a document. I think that would be one easy way for them to sidestep demanding that certain people have it. By the way, there's an interesting legal case in America that may have some effect on this. And this is kind of weird, but it's a 116-year-old Supreme Court case called Jacobson versus Massachusetts. And this was the case that decided that the federal government cannot force you to get vaccinated, but that individual places could require vaccination for you to enter. So for example, a hospital could say you have to be vaccinated to work here. A venue, a trade show venue, could say you have to be vaccinated to come in here. So the legal groundwork for that does exist in America. And I suspect that for part of the rest of this year in some states, but I'm thinking probably not Texas and Florida, they might require it. While, however, I think the airlines might be pressing for it because it's an easy way to make sure that people are safe. And it's an easy way also, when you think about it, to build consumer confidence, because part of the problem we're going to face in this industry is people feeling confident enough to come back to trade shows.
Yeah, and well, vaccination is one thing. What about testing, and what about social distancing? Yeah, well, now again, European perspective. When you're looking at the European idea, the general direction is that tested people are treated the same way as vaccinated people, or those who have been who were infected but got healthy again. So these three groups should be treated in the same manner, although testing means you have to test yourself every second or third day. Yeah.
Right. Now, testing, I think, has still hit a wall that we have not climbed over. And that is, we need easy, quick, at-home tests. The newest one about to come out is by Abbott, and it's called Binox Now, and it will enable you to do a swab at home and give you a result within 15 minutes. My problem with that is, again, the nasal swab needs to be deep, and I think people are uncomfortable pushing a swab that deep into their nose. One group at the University of Nevada in Reno is working on a breath test that can give you a result in literally 30 seconds. There's another group in Amsterdam, I believe they're called Breathomics, and they're doing one that is similar, that you will simply exhale a breath and it will analyze it on the spot, very much like the so-called breathalyzer that can tell if you're drunk. But it's an easy and unintrusive way of testing you. I think these have to come out first before we can really make testing widespread enough to be convenient enough for people to want to use. And we have to get them without a doctor's prescription. They have to be something you could go to the drugstore and buy and use easily. Because part of the solution to COVID is, again, getting constant tests or being vaccinated, whichever, but making sure that, again, if you come in, you're safe. Now, here too, I think at shows, we'll probably do, I think to some degree, temperature scanning before we do testing, because that can be done from a distance without touching somebody. And those whose temperature hits 38 degrees Celsius or 100.4 degrees Fahrenheit can then go to a second location and get a second test for their temperature to make sure that they're okay. This will probably continue in some areas. And indeed, they used it at the Surf Expo in Florida in the early part of this year, and it seemed to be fairly popular. That is, people did not seem to object to it. I think we'll be seeing a little bit of that for some time to come, but testing on site, I think, is too difficult for people to do and probably too expensive for a trade show organizer to do.
Is there any free testing in the US?
They have done some in Florida in conjunction with trade shows, where the local Department of Health and the trade show organizer have done it. And I think that's a good way for people not to have to pay for it to be done. That's probably quite important. In other words, to get trade shows back on their feet again. Any sort of congregation of people runs into this problem of testing to make sure you get in and you're safe. Can you build confidence? Some people call this hygiene theater, but I actually do believe it's important to build confidence throughout the rest of this year. Because if, for instance, World of Concrete takes place in Las Vegas and you hear about 100 people came home with an infection, that's not going to build confidence in people going back to trade shows. We need to monitor this carefully.
Yeah, but the second part of my question was, well, have your coffee first. So, second part of my question was about social distancing and wearing masks and elbow bumps and feet bumps and so on.
I think we're going to maintain this at least in the US for a while, and because there are two reasons. The biggest reason is the vaccine hesitancy. And that is a major problem around the world. So let me back up here. At the end of 2020, there was a study of 31 studies done, which showed that France, Italy, and the United States had the lowest rate of its population saying they would get a vaccination. That number went between 53 and 59%. That's all who said they would get a vaccination. At the same time, the Gallup polling organization did a study of 117 countries around the world. 79 of them had acceptance rates of 70% or lower. What that means is each of these countries has an enormous amount of people who will not get a vaccination or are scared to. Currently, that number in the United States has declined from about 42 to about 22% who are adamant that they do not want to get a vaccination. What that does, of course, is allow many people to evolve variants. So that's the second reason. I think we have to maintain these protections in shows because of the problem with variants. Now, the London School of Tropical Medicine and Hygiene has indicated that the B117 variant, that is the one from Britain, and the B1351 variant, the one from South Africa, were the most communicable and the most deadly. That is, they were 30 to 50% easier to transmit. And one study indicated the South African variant could be 55% more deadly. So again, we probably have to maintain these measures to protect us because we still don't know how powerful the variants are. But I do have some good news. The New England Journal of Medicine just published some research from Israel and Qatar of several 100,000 people. And it indicated that the Pfizer-BioNTech vaccine could prevent roughly 89 to 97% protection against the variants. That's excellent because it means that if we've had our regular vaccination, we are pretty well protected against the variants. That was for the British variant. The vaccinations protect about 72 to 75% against the South African one. But again, that's still very, very high. And we should also know that probably by late fall, Moderna will come out with a booster shot for the variants, and probably Pfizer-BioNTech will as well. Now, going back to trade shows though, on the floor, I believe many are still going to have markings to maintain 6 feet. I believe that many shows may still use the formula of dividing your space by the number 28. And then you can figure out how many people at maximum should be in your space at that point. I believe many shows will probably use that at least through the end of the year. These are measures that we still have to maintain. Now, one thing is going to happen in the United States, possibly this week or next week. I believe the Centers for Disease Control might relax the face mask measures for inside spaces. That's good, and that will give people a feeling of confidence, but I believe many will probably not be that quick to give up their face masks just yet. They're cheap, they're effective, and we know that, of course, many people will not get vaccinated, and we still aren't completely sure how easy it is to transmit viral particles from someone who's had the vaccine to someone who hasn't had the vaccine, even though the early studies look good in that regard. Until the end of the year, we'll probably have to err on the side of caution with these measures at trade shows, at least I think in the US. And I suspect some of the rest of the world will also be very stringent about them.
Okay. Actually, do you have any measures taken by the venues like air filters, or there's a technique using high concentrated oxygen, or oxygen and sunlight helps. UV radars?
Yes.
Yeah.
This is a really interesting area of research. And most people weren't really thinking about air controls when this started, but this is probably the most important aspect to a venue. So for example, you should look for a venue that uses a MERV, M-E-R-V, a MERV 14 air filter. It's a hospital grade air filter that is extremely effective against the virus. The virus is these can usually filter out viruses 0.1 microns to 0.3 microns in size. The COVID virus is about 0.125 microns, so these filters can handle it. Now, at the same time, the Centers for Disease Control have a good idea and a good suggestion for places that don't have these brand new air filters. They suggest that you increase the amount of outside air coming in through your regular HVAC systems, and also decrease the ability to shut down airflow when occupancy goes low. That is, many venues are set to slow down their airflow when the number of people is reduced in a space. The Centers for Disease Control say, stop that. Don't do that anymore, because it's important to keep that airflow going. Now, this is even more important now that we have accepted that the virus passes not just through droplets from your mouth, but just on the air itself. This has become extremely important to know. Now, there's one other aspect that I find fascinating. A researcher named Stephanie Taylor at the Harvard School of Public Health has determined that humidity is a key factor in passing on the virus. So she recommends that venues keep their humidity fairly high, between 40 and 60%. Now, by comparison, the Mojave Desert outside of Las Vegas is about 30% humidity. So why is this important? Because the higher the humidity, the more a respiratory droplet becomes heavy and it falls to the ground. So for example, if you had exactly the same event in New Orleans, which is very humid, and Las Vegas, which is not very humid, you would be in much more danger in Las Vegas as opposed to New Orleans. And there's been some fascinating work done by the University of Sydney and Fudan University in Shanghai. They found that the correlation between humidity and infection is definite. They say that for every 1 degree of humidity you go down, the chances of infection go up 7%. Okay. So there is a huge connection between those two things. So those are things that we need to look for. There's also been some work done by the University of Houston and a corporation called MedStar, which has created a filter you can fit into old HVAC systems, which can basically burn out the virus. It can eliminate about 99.8% of the virus. So again, I think it's important for venues to be transparent about what measures they're taking and what technical changes they've added and how they've changed their airflow. Those are things that I think the exhibition industry needs to focus on, and the things that the venues themselves need to communicate to people, especially exhibitors and attendees.
Okay, sounds interesting. And is there any subsidies to help venues, or is it the free flow of market right now?
In the United States, it's more the free flow of market. I suspect, though, that in the beginning, the facilities themselves will pick up the cost because they want to attract people back. They don't necessarily want to add on costs for exhibitors and for show organizers. So I suspect that they themselves will pick up the cost. However, I would guess that in the future, and by that I mean, let's say 2022, 2023, we might see more of these costs, if they exist still, come down a little bit to the show organizers and perhaps even attendees themselves. But until then, I like to think that most of the facilities and the venues will pay for these changes because they have to, Uta. They have to do that to bring people back.
Yeah. Actually, one thing which just came to my mind is the legal point. What's going to happen when you're looking at a situation where the venue or the state says you don't have to wear masks, and now you have an event, and well, it should not be a super spreader, but maybe it's a spreader. Do we have the situation that there are some legal coverage, some cost coverage for the infection, so hospital costs are covered by the state or the venue or the organizer, or is there any kind of insurance?
Oh, this is a great question. Look, let me back up a second, Uta, and just say, The reason this is important for the exhibition industry is because there is a 120-year-old economic principle that epidemiologists believe applies to the virus. It's called the Pareto Principle. And it says that 20% of results, or rather 80% of results, are caused by 20% of people. So in other words, 80% of your sales come from 20% of your people. 80% of a virus is caused by 20% of people. And the reason that happens is because people congregate in an area. And currently, the one research institution I mentioned before, the London School of Tropical Medicine, they think the number could be as low as 10% of people causing 90% of infections, again, in groups. And Nature magazine followed 94 million people and concluded the same thing, that groups of people are causing these problems. So that goes to your question about who's going to pay for this, what's going to happen. Currently in the United States, that's the liability issue. And here's something interesting. I think you can tell the worry about liability based on one metric. Companies that have restrictions against flying. Currently, about 75% of the people that Exhibitor has researched say that they have company restrictions on flying. That's down from about 84%, though, about 4 months ago or so. The lower that number goes, I think the less worry there will be about liability, because someone will sue someone else. Now, currently in the United States, there are, as of last week, 2,377 lawsuits against institutions based on COVID-related policies. 188 of those are class action suits. So that means they're huge lawsuits. This probably will expand to the exhibition industry in some way once we get back up again, and if some people suffer infections at a trade show. So what we'll see is this. Individual states, about 13 of them in America, have now passed legislation protecting against lawsuits, but only 13. On the federal level, we have a piece of legislation called Safe to Work that's in the United States Senate, but has not passed, because some people object that all you have to do to be protected against lawsuits is have a written policy that says we're doing our best to prevent COVID. A lot of people think that's too easy, or that's too easy a protection for companies to have, and they want something much more stringent. A company called Predicate in the US has estimated, though, that lawsuits based on COVID might do about $20 billion worth of damage to the economy. So it is vital at some point that we pass something nationally on a federal level that gives companies some kind of protection against lawsuits to some degrees, because this, think about it, this will affect the exhibition industry in a huge way if we don't have some kind of protection.
Do you see it on an exhibitor level that well, you're going to an exhibition, just visiting one or two booths, and then you come home, got infected? It's pretty clear that this happened at booth A. Can you sue the exhibitor, or is this covered by the exhibition, or?
Oh, great question, because in America, we have a saying, you sue the person with the deepest pockets. So in other words, who has the most money? And probably in that case, it would be the venue, or it might even be the show organizer. But you could also sue the individual exhibitor, because let's say that you go to a consumer electronics show, and let's say that many booths have staff wearing masks, but one booth did not. And you sue believing that that booth gave you, COVID. At the same time, you could say that the venue And you could say that the show organizer did not take enough measures to protect you by forcing exhibitors to have everyone wear masks. This is a legal area that's going to be fought out in the next few years. But my best guess would be that you'll see the venues themselves and show organizers possibly being sued, which would in turn force them to be much stricter about saying exhibitors and attendees have to wear masks. That's why I suggest that even though around the country we may relax some of our standards, I think that exhibitions are going to have to stay with those protective measures for a while to come, just to avoid lawsuits.
Okay, yeah, well, makes sense, and gives a good impression on what we're gonna have to expect, and that we are probably will be wearing masks at least in fall and spring and winter next year. So that yeah, to be
I think so.
better safe than sorry. It sounds like, yeah.
Uta, that's it. I mean, look, we're used to wearing masks now for over a year, and this year has been the longest century ever. But you know, the thing is, we're used to it, and we understand that masks are vital and social distancing is vital, and they do work. And I believe that many people will simply want to keep wearing them just to feel a little bit safer, and that's okay. There is no problem with wearing it and feeling a little safer. But I believe, yes, that will last through the end of the year. And we'll find out at Exhibitor Live in late October and early November, we'll find out then how our people feel about it. And I think that will be a good indication of where the industry is at that point.
That's for sure. Actually, before I open up well, we are talking almost 45 minutes now. Which time flies.
Yes.
Before I open up this session for questions from the audience, I have still one. You mentioned very much at the beginning that Salesforce will do their Dreamforce convention as an on-site event. So, well, we all know that Salesforce is one of the bigger IT companies, and they should love all kind of IT, Zoom, Teams, whatever, you name it, you got it, sessions, and they are now coming back to an on-site event. Did I get it right?
Yes. And you're right. They should love it, but Zoom has its limitations. And of course, we now have that famous term, Zoom fatigue, because people don't like looking at themselves on screen. And when we talk, I have to look into a camera, though I can't really look into your eyes at the same time. So it's a very difficult disconnect. And even though technically it's helped make some meetings possible, that's for sure. I believe that the need to touch, to meet in person, is so intrinsic a human need that this year, unfortunately, has shown us how badly we need trade shows, how badly we need to connect in person. You cannot replace that any more than computer dating. You know, online dating doesn't replace meeting in person, does it? It's just a way to facilitate meeting people. Well, online Zoom meetings do that, but it doesn't replace meeting people in person, getting to know them, going out to dinner with them, being able to have an intimate conversation with them. None of that can be replaced by technology yet.
Well, this could be a perfect end of this session, but still, are there any questions from the audience? Since you are so familiar with so many statistics, with so many research which were run, it's amazing. You're like an you know what I wanted to say, yeah? These old books, old books where you can look at things up, encyclopedias. And well, it's your chance now from the audience. Any further questions from your side? Justin, yes, please.
Just on the, it must be, if you're not hearing me, you can tell me because I'm not using my normal computer, I'm using a borrowed computer. You can hear me, can you?
Yes, we can.
The question I've got is, in terms of the temperature check-in, and I've had COVID, my wife's had COVID, my daughter's had COVID, and there was no temperature issues there. I wonder how effective it is in terms of temperature checking. I don't know how many people, exhibit a high temperature if they've got COVID. I don't know what your thoughts are.
I'm sorry, Uta, I could just barely hear that. Could you repeat the question?
It was about temperature check. Justin just stated that parts of his family had COVID and they didn't have higher temperature, as well as you can take an aspirin or a Tylenol and you lower your body temperature. So how reliable is this temperature check?
This is why the World Health Organization did not expressly back the idea of temperature scanning, because you could be asymptomatic, you're right. Or you could take what's called an antipyretic, meaning you could take aspirin to lower your temperature. But I believe we look at it as an imperfect filter that can still monitor people. For instance, let's say you do find 10 people who actually do have high temperatures. The standard procedure then has been to take them to a second location and recheck, because that high temperature could be caused by wearing a scarf. It could be caused by wearing a hat. It could be caused by the ambient temperature being very high. It could be caused by your rushing to the convention center and your body temperature goes up a little bit. So I agree it is imperfect, but if it did catch 10 or 15 or 20 people who do have a high temperature indicating COVID, and on the second check again show a high temperature, isn't that better than nothing? Isn't that better than not checking at all? And I think that's how many people have to view these defenses. A mask is not perfect, but some research from the University of California at Berkeley indicates that if 80% of a population in any group, in any size, wears a mask, that can reduce infections by 92% overall. Again, it's not perfect, but it does help. And while some temperature scanning might seem to rely on, for instance, the person doing it and those other factors I mentioned, research in Canada in 2014 indicated that on the whole, temperature scanning does work. So while imperfect, I would say it's better than nothing. It's one of the many defenses we have to use against viruses, whether it's COVID or whatever new virus we're going to encounter next year or the year after or the year after that.
Peter, you just raised your hand.
Hi, Charles. Hello, everyone. Nice to see you all. Thank you, Charles. Really interesting, all the points and the details that you're giving us. Question, are you aware if in the US there are any protocols during the setup, and are these different than for the visitors?
Yes, I would, however, say it's mostly institutions who are following the Global Biorisk Advisory Council 20-point measures. Now, they're basically working with venues such as McCormick Place in Chicago, as well as airlines and all sorts of institutions, to institute safety measures during setup. That's one of their key points. And I think if you are going to a venue, I would ask if they're following their procedures called the GBAC star rating, to see if they are following those setup measures. Otherwise, at least ask the venue if you don't have the GBAC star rating, are you doing these procedures during setup? Because Peter, that's a great question, because that's the invisible part that we don't notice, would we? It's before this, it's before people come in, what's been done in terms of cleaning, in terms of keeping people safe from infection, that someone during install could give to an exhibitor or give to someone just walking around the show floor. This is an important point that I think is incumbent on everyone going to a show to try to check out to see if during setup they are doing some kind of safety procedures.
And do you believe these people the staff needs to be vaccinated? The setup.
I would say ideally, again, for these reasons, because the early research indicates that not only are you about 95% infected, in fact, it might be better than that, Peter. The most recent research from the Centers for Disease Control, based on following 95 million vaccinated people, says that breakthrough infections, that is, I'm inoculated, but somehow I still get COVID, breakthrough infections are down to 0.009%. In other words, they're not going to get sick. And I referenced a little while ago that indicates up to 97% of people will be prevented once vaccinated from accidentally passing on viral particles to others as well. So I think ideally in those cases, unless you have a medical or possibly a religious reason for avoiding a vaccine, I think it would be very wise to get vaccinated, again, because you're making your staff safer, the statistics back it up, and you'd be able to build confidence in anyone around you or coming to your booth, that the chances are you're going to be safe. Again, I want to emphasize the words chances are. Nothing's perfect, but this increases your safety.
Thank you.
Yeah, the travel risk will still be there, yeah, and other things which can happen to you when you're having a car accident or so. We are not living in a perfect world.
No.
And as we all know, most of the injuries happen in your own household, in your own home.
You know, you're right.
Yeah.
You're right. And you know, for a second, step back for a second, everybody, and think. The average time to create a vaccine is 12 years. Before this, the fastest it was ever done was about 4 years. What if the exhibition industry had to wait 4 years for a vaccine? As rough as this had been, and the Center for Exhibition Industry Research indicates we've lost 80% of the value of the industry in this year. That's about $84 billion. As bad as that has been, imagine if we had to wait 4 years for a vaccine. As rough as this has been, this is good news. As terrible as this has been to everybody involved, things are looking up. There is light at the end of this tunnel. It is getting better.
Sounds great. Any further questions from your side? Otherwise, we were 7 minutes early, which is wonderful. I think it was a lot of content. Of course, we did a recording. So if you want to watch it again, or if you want to share it with your colleagues, your friends, your whomever wants to travel. It's interesting for everybody who wants to travel or needs to travel, not only the exhibition industry. So happy to watch it on our YouTube channel, which is linked to our website. And well, I see a lot of chapeaus in our chat function, in our chat group. So everybody's pretty happy. Thanks, Charles, for having us today, for explaining all these beneficial and interesting and new facts, because, well, to understand one thing helps to act in the right manner and takes fear away. So it was really great to get these insights from your side. And yeah, well, looking forward to see you in your 70s dress, and I will recall this.
I will bring it. I will bring it. Okay.
Perfect. Thank you.
Oh, Uta, I'd also like to invite anybody, if you have more questions, please feel free to contact me at Exhibitor Magazine. Uta can give out my address there. If you have any questions, please just send it in and I will be very happy to answer it for you. This is an ongoing problem, and we have to kind of keep the information flowing back and forth. So please don't hesitate to contact me.
Thanks for this offer, and thanks for being with us today. And yeah, see you soon. The sooner the better.
Everybody, goodbye.
Goodbye.